Hello, very good morning to you. You're watching Breakfast with Dan and Louise.
It's just gone 7:30 and as promised, delighted to say, this morning we'll be putting your questions to England's Chief Medical Officer, Professor Chris Whitty.
Let's join him right now. A very good morning to you. Thank you so much for joining us. It was a very difficult time for you, a very busy time for you as well. A lot of questions and we've got time to get through quite a few of them. So let's start with Tricia. She says, we keep hearing the new variant is far more transmissible. What does this mean for the general public? Where is it being passed on?
Good morning. So I think the first thing is to understand quite what this new variant is meaning in terms of numbers for the NHS. The peak we had back in April last year, we had about 18,000 people in the NHS. We currently, as of yesterday, have over 30,000 people in the NHS. And a week ago, all the four chief medical officers for England, Scotland, Wales and Northern Ireland said this is going to be a significant crisis for the NHS unless we take evasive action. And this new variant is really pushing things in a way that the old variant, which was already very bad, was not able to. So we have a very significant problem. Here in London, for example, 1 in 30 people currently have this coronavirus, according to the Office for National Statistics. Across the country as a whole, it's 1 in 50. So this is a serious problem and it's rising in every part of England. So what we need to do, because the next few weeks are going to be the worst weeks of this pandemic in terms of numbers into the NHS, what we need to do before the vaccines have had their effect, because it's going to take several weeks before that happens, is we need to really double down. This is everybody's problem. Any single unnecessary contact you have with someone is a potential link in a chain of transmission that will lead to a vulnerable person. So you've absolutely got to, we've all got to, as individuals, help the NHS, help our fellow citizens by minimising the amount of unnecessary contacts we have.
And just going back to that question, if I could, she says we keep hearing it's far more transmissible. So where, can you tell us about where it is being passed on?
Well, the virus can essentially be passed on in any place where people from two different households meet together. So it can be passed on, and very often is passed on, in households when people invite people into their home and meet them who are not from their household. Of course, it can be passed on in any other environment, outside, in shops, in any kind of environment and an indoor setting. But the key thing is to understand that it's when you meet people from another household under any circumstances, and they're very often your friends, your family, but those are the kind of situations where the virus is passed on. It doesn't care who you are, it doesn't care whether they're your friends. If you meet someone from another household, the virus has an opportunity to be transmitted.
Professor Whitty, on that issue that you've just touched on there, Nathan has sent a question this morning saying, government are saying don't mix households, as you just sort of reiterated there. But tradesmen, like himself, he says, I'm a tradesman, we're able to enter multiple houses a day carrying out non-essential works.
Well, I think what we're trying to do is we've got to make this sustainable, because we've got to be able to maintain this for several more weeks now. We're really going to have to do a significant action for all of us for several more weeks, until sometime in the spring for very much of what we have to do. And so we do, obviously, people need to be able to do essential works which they can't do from home. We fully accept that that's necessary to keep society going, because we've got to be able to do it over a period of time. So the three things that people can leave home for are essential work where they can't do it from home. When they actually are doing exercise, it's very important for people's health, their physical health, their mental health, to take exercise. And of course, for essential things like shopping or medical interventions. So we do, all of us as society, accept that people need to work outside home in some situations. But if you can work at home, you really should.
And we've got lots of questions about the rollout of the vaccine. This one particularly from Kathy, and other people will be wanting to know the same thing. I was given the Pfizer jab on December the 12th, 2 days before my second jab. It was cancelled. Can you guarantee I'll be OK to wait 12 weeks between doses?
Yes, so it should explain the reasons for delaying the second dose. The thing which is limiting us at the moment is the amount of vaccine in the country. So for every person who gets a second dose, someone else is not even getting their first dose. And it's very important we actually vaccinate the maximum number of people over this really dangerous period over winter, the next few weeks, which are going to be the worst weeks of the pandemic in terms of numbers into the NHS. We must be vaccinating as many people as we can. Now, the specialist committee, the Joint Committee on Vaccination and Immunisation, looked at this very carefully. And their view was, and I and all the other chief medical officers agree with this view, that the evidence is that the great majority of the initial protection comes from your first vaccination. You absolutely do need to get the second one, but that can be delayed by a few weeks. And we do not think that there will be a significant reduction in the amount of protection over that period of time. So the most important thing is to get the first vaccination, but it is important that then people go back after 12 weeks to get their second vaccination.
OK, thank you for that answer. One of the other themes Louise is talking about, we've tried to theme some of these thousands of questions into blocks for you, some of the big topics that keep coming up. And one of those is nurseries and why they're still open in parts of the UK. And Sarah has got in contact with us about this. She says, Professor Whitty, why are preschools and nurseries open to all children in parts of the UK in this lockdown? It's a wrong question on we've had on the screen there, but that's about nurseries, Professor Whitty.
So one of the things that ministers have been trying to do is to balance making life possible for people with absolutely minimising the amount of interactions. Now, very important to stress that the risk to children in nurseries, and the same is true for children in schools, is exceptionally low. One of the very few things that is positive about this virus is compared to other viruses, it relatively affects children less. That doesn't mean it never does, but much, much less. So the risk to children themselves is very low, but it is important for some people to be able to get out to work, and nurseries do allow that to happen. But we would encourage people under almost any situation to try and minimise the amount of contact they have with other people, whether it's through nurseries, meeting at the nursery, all the kind of other contacts people have. Try and keep those to an absolute minimum.
Can we ask you this question from Paul? He says, why have teaching staff not been included on the priority list for a vaccine?
The initial priority list was entirely based on who are the people who are most likely to die from this disease. And they are predominantly, and those who immediately care for them. So those are people who are either the very oldest, and that's the reason why the initial vaccination rollout, the initial prioritisation is for care homes and for those over 80, and then to go down in age, and then for frontline health staff and for social care workers who are caring for those people, because there is a risk that if they're not vaccinated, they are a higher risk of getting the infection and a higher risk of transmitting it, and then we'll go down the ages. Teachers are a very important group, but they're not at any greater risk in terms of dying than other professional groups of their age. So the first wave of vaccinations will be for people who've got the highest risk of dying compared to the general population. And then as we go down the list, ministers will be wanting to make decisions about other groups where the risk is much lower and where obviously we have to think through what are the impacts for society. But the most important thing at the moment is to get through those initial lists. The Prime Minister has talked about getting down the first 4 lists. So that's down to people in their 70s, those who are their professional carers, and those who are the most vulnerable. And those are the lists we should prioritise first, because that's where the majority of those who are dying are coming from. And then after that, we start to make choices as we go further down the lists.
We've had so many questions about restrictions and tighter restrictions, and many of our viewers looking at some of the front page of the papers this morning have seen speculation about tighter restrictions. Here's a question from Nicola, Professor Whitty. Do you think the current lockdown restrictions should be tighter, and if so, how? What might we be looking at?
The thing which I think is the most important thing at this point in time, I think ministers are always looking at whether they should adjust restrictions in either direction, but at this moment, obviously, definitely not relaxing them. But the most important thing is that people take the current rules very, very seriously and do the minimum contacts they have. I think that is, in a sense, the most important thing now, is for people to actually say, look, these are the rules, they're really clear, and we shouldn't do anything that's outside them, but we should actually, even within them, we should be doing our level best to minimise the amount of unnecessary contact with people who are not from our household. That really, I think I can't emphasise that enough. when you think about the pressures there are on the NHS at the moment, that is the thing that all of us can do to help relieve the pressures over the next few weeks.
Okay, and I think a lot of people feel, the need to do that. But some of the things which are potentially being suggested, I don't know whether you're able to comment on these, looking at masks being mandatory when in an office, for example, and also the ending of support bubbles. Can you tell us anything about that this morning?
So the decisions about exactly what restrictions are in place are very much a matter for ministers. I'm very happy to answer medical questions or science questions, but I really don't want to sort of take the role that is for ministers to make decisions about rules that they're discussing at the moment.
Can I ask, on that issue, do you feel, again, I know you can't talk specifically about policies, but one thing that's come up quite a bit in the questions we've been coming through is, do you feel now, even though you're not obviously making policy, you're advising, that people are far more willing to listen now in terms of in government than they have been in previous months?
Well, I think what all ministers and all politicians, and this is true in all 4 nations of the UK from all the different political parties, they're all having to struggle to balance 2 different things: trying to keep the coronavirus epidemic under control and trying to keep society and everything else going as well. And they're walking this incredibly difficult path between those 2 aims. But I think everybody accepts that this is the most dangerous time we've really had in terms of numbers into the NHS at this point in time. So absolutely, politicians from every political party, leaders from every nation are looking at this incredibly seriously at the moment, and all of the rest of us have to as well.
And so many people will be watching this morning thinking, should we be, for example, expecting perhaps tighter restrictions?
Well, I think I'm going to double down on my previous answer. Actually, if people are taking this very seriously, if they are minimising the number of individual contacts they have to the absolute minimum outside the things they have to do for work and for exercise and essential things, that is the most important thing. In a sense, tinkering with the rules may be useful, but the far more important thing is that everybody abides by the spirit of the rules that are there at the moment. Everybody knows what they need to do. And I think that's the key thing, is minimise the number of contacts, because every unnecessary contact is a link in a chain that could lead to a vulnerable person being infected.
Can I ask you this question from Susan? She says, and this is echoed again by other viewers as well, why are professional football matches and other team sports being allowed to continue?
Well, as you know, as I previously said, I mean, the balancing act is trying to minimise the amount of contact outside very structured environments, whilst trying to keep some semblance of life as we all know it, and that's the balance that ministers are always having to make in every nation when they're trying to make these decisions. But most people are not going to be catching their coronavirus that way. It is very much a matter for individuals in their day-to-day life. And I'm coming back to this because that, I think, is the thing to concentrate on. If we keep on looking for someone else's problem as to why this is not going to get better, we're missing the point. What we've all got to do is say, what in our own lives can we do to minimise the amount of impact we have on the NHS, on vulnerable people, by minimising the amount of contacts we have.
Back on the 17th of March, which seems like a lifetime ago now, Patrick Vallance, the Chief Scientific Advisor, said less than 20,000 deaths would be a good outcome for coronavirus. Now we've passed 80,000. Are you shocked by that figure, considering where we were back in March and all the things that we have tried to do since then?
Well, I think it is a shocking figure, and I think anybody who is not shocked by the number of people in hospital who are seriously ill at the moment and who are dying over the course of this pandemic, I think has not understood this at all. This is an appalling situation. We are now very close to the point with vaccination that we're going to be able to get on top of this, but it's not yet. And what we really have to do, if we want the numbers not to go up still further, is everybody has to minimise the number of unnecessary contacts they have in their day.
Can I ask you a question? This is from Jan. She says, why hasn't my 91-year-old mum had a vaccine? Feels like she's been forgotten.
So there is, as everyone will realise, there's really now quite an acceleration of vaccination that's going on across the system, and it's going on. Today's was the start of the rollout of very large vaccination centres, but much more importantly, for many people, general practitioners, GPs, hospital hubs. In due course, we're trying to work out ways of doing it with pharmacies. These are the ways which different people are going to get their vaccination, and there's an absolute determination to get to the point where the oldest people, those over 80, and those in care homes are vaccinated first, along with health and social care workers who care for them, and then we can start going down the ages. So I'm very sorry to hear she hasn't yet had her vaccine, but I very much hope she will do very soon.
Can I ask you as well, because we saw a question go up about shielding, so many people asking about shielding. That question was from Barbara, asking about she's had her first Pfizer vaccine. Does she need to shield? Another question about shielding. This is from Dan, who says, my wife has COPD and asthma, can't go into work, but I have to go into Royal Mail delivery office. Why am I not being told to shield as well, like I was before? So just can you clear up what is happening with shielding?
So I'll take those, and they're obviously two very different issues. In terms of people who've had a vaccine who are shielding, firstly, I'm very pleased to hear that, because that will provide, after a period of, there's a delay of somewhere between 10 and 21 days before people start to become protected. So the protection isn't immediate, but people are to a large degree protected after the first vaccination, but it's not a complete protection. And I'll go back to a figure I gave at the beginning. In the UK at the moment, 1 in 50 people have got this virus, and in some parts of London, it's even down to 1 in 20. So there's a very big risk of people going out and being exposed. And even if they got the significant protection of the vaccine, it's not complete. So we need to do two things. We need to vaccinate everybody who is vulnerable so that they have the substantial protection from the vaccine. But we also have to get the rates down in communities. So when people go out, the chance of them coming into contact with someone with the virus are a lot lower. In terms of the shielding rules are much more similar than they were to the March ones than they were during the last lockdown, but they're not completely the same. And this is to recognise the fact that many people felt really imprisoned by the shielding rules of the first time round, which was not the intention. And I think this was very difficult for people's lives and their mental health and a variety of other things. So there was a recognition that we needed to adjust that, and for that reason, some of the shielding rules have been slightly relaxed. But the general principle that people who are on the shielding list need to take real care at the moment because of this very high rate of the virus, I think everyone would accept.
We spoke to a professor working in intensive care, and he spoke about his exasperation this morning over those people who say the NHS is always under pressure at this time of year. This is no different. How exasperating is it for you? I suppose one of the reasons why you are here this morning and not a government minister is to try and get this point across, that there will still be people watching you this morning saying these things, saying it's not happening.
I don't actually think that the great majority of the British public, who are incredibly sensible, think this is not happening. I think people realise this is a very serious problem. We will get through together, but at this point in time, we're at the worst point in the epidemic for the UK. And I think there are always going to be noises of people who come up with absurd theories and suggestions of things that are either obviously not true or a misunderstanding of what's going on. But I think anybody who looks at some of the reports that the BBC and other news outlets have done from hospitals, anyone who talks to a doctor or a nurse working in the NHS, anybody actually who reads any newspaper, they will know this is a really serious problem. This is not a typical winter. Every winter there are problems. This is in a completely different league.
And just sort of looking ahead, and there's a lot of people asking this similar question as well. This is from Mike. He'd like to know if we can ever go back to life like before. No masks, mixing in groups, packed into pubs. I mean, so many people would like to know the end date. Can you help?
Well, I think that, the first thing is I'm confident we will go back to life as it was before at some point. That's not in doubt. That's the life we all want to lead. And what will happen is we will be able to get, once the vaccination has rolled out across a wide enough part of the population, so that the most vulnerable are protected, but also so that enough people are protected to actually reduce the risk for the whole society. That's going to take a rather longer period of time. But not months, not years. We will begin stage by stage over the next period. People will be able to have the restrictions lifted It won't happen in one go. And at a certain point, hopefully, you'll get back to a life that is basically exactly the same as it was before. However, we're quite a long way away from that at the moment. And I think what I really would like is for people to concentrate on the period now, fully accepting that we all want life to get back to normal, and life will get back to normal, but it will actually get back to normal more quickly if we can get on top of this early now, get the vaccine rolled out. If you get invited for a vaccination, please take up that offer. And that's the way we will get on top of this epidemic and by stages get back to the life that we all want to lead.
Thank you for spending so much time with us answering those questions. You'll be pleased to hear as well that the great British sense of humour has been maintained through all of this. Quite a few people have asked, with all you and many other people standing at the podium talking about next slide, please, quite a few questions saying, did you get a clicker for Christmas so you can stop asking for the next slide?
I'm rather hoping someone has sent one to Downing Street. I think they said they had, but Downing Street have not passed it on to me. But I can completely, I'm with them on this one.
OK, and many people will... Yeah. I think that's one of the hated phrases of last year. Next slide, please. But thank you very much for being with us this morning, Professor Chris Whitty.
Thank you very much indeed for your time. It's a very busy time for you. Thank you so much. And I hope, we tried to get through as many of your questions as we could. Thank you very much indeed for sending them in. Somebody's got a really good clicker.
I know, you need to lend that to Professor Whitty, Carol.
I was just thinking that. Good morning, both.
Next slide, please, Carol.
Okie dokie. Good morning, everyone. You can see this lovely Weather Watchers picture taken in Kent this morning. It's quite foggy here. We've got some pockets of fog, but for most of us